I want to talk about how root canals can make you sick. When I was studying biological medicine back in the mid-90s, one of the things we learned is just how toxic root canals are. I'm going to give you a book if you want to learn more. It's called The Toxic Tooth: How a Root Canal Could Be Making You Sick. And Dr. Thomas Levy is one of the authors. He's one of my favorites. But now I looked up on the internet to give you a book, a reference book. And this is what AI says about it. Books that argue root canals cause systemic disease generally fall outside of mainstream dental science and are considered controversial. These texts often base their claims on historical, debunked research. And that is really not true. Early experiments with root canals involved using rabbits, unfortunately. And what they would do is take a root canal tooth from the mouth of someone who had a particular disease, say diabetes, and then they would just make a little cut in the skin of a rabbit and insert the tooth and sew it back up. So the rabbit is now carrying that root canal tooth. And lo and behold, the rabbit would get that diabetes. And they did this with multiple different kinds of illnesses and health conditions, proving that the unhealthy microbes that can grow in a root canal can be at the root of many health conditions. It's fascinating. So if you've already had a root canal, what can you do? You could have it removed, which is what I did. I had a few, and when I learned about this, I did have them removed. But if you don't want to do that, or let's say you have a tooth that's going bad and a root canal is being given as your best option, you do have something else you can do. You can get a laser. Now, this is a better laser than just a laser pointer, but a laser pointer, that you would use in a presentation would do the same thing. You can see, the red light of the laser here on my hand. That's what you're going to do. Laser light will penetrate a little bit into the tissue. And so you can pull your cheek open and wave the laser back and forth at the gum line for about 30 seconds. Try to do it on both the inside and the outside of the affected tooth. If it is a root canal tooth, it will help to kill the microbes, the unhealthy microbes that are there. If it is a tooth that is threatening to go bad or going bad and you want to avoid a root canal, you do the same thing. Do it every day. Make it part of your toothbrushing routine. I have helped many, many people save their teeth by using this kind of treatment, and it's amazing. Now, you can use homeopathic remedies with laser because homeopathy is just a frequency. It's a healing frequency. A laser is also a frequency, and the homeopathy will piggyback on the laser and go deeper into the tissue. So let's say you have a tooth that's threatening to go bad, you have a toothache along with that. You can use a homeopathic remedy called Trameal, or there's another remedy called Arnica, and if you cannot find it in a liquid tincture, and you can only find it in the little sugar pellets, that's okay. Just take a few of the sugar pellets and dissolve them in some water. Take a little dropper and drip a few drops of that around the tooth, and then use your laser and just laser it right into the gum tissue there. I'm telling you folks, it's a very powerful therapy, and it's just one you have to stick with. That's the only downside. It needs to become a part of your routine. Don't let it drop out, because correcting these issues with these microbes in the mouth can really make a good difference in your health. On a side note, if you have gum disease, and let's say the tooth is not bad, but you still have gum disease, you can use this. You would pull your lip out. I'm going to avoid that picture here. But you pull your lip out and do it along the gum tissue that's infected. And over time, it's going to get better. And along with your flossing and other program that your dentist has given you, the laser is really going to speed your recovery.